Hi everyone, in this small video, I'm going to explain the difference between the word concept and construct. We all know that either in nursing research or in nursing theories, we use these words that is called as concept or a construct. Sometimes we use it interchangeably without knowing the difference between what is a concept and a construct. So, in this video, I'm going to explain the subtle but the important difference between these two things that is concept and the construct. So if you feel this video is useful, please do share, like and do subscribe to my channel. So without much delay, let's move on to the content. So first, let us see what is a concept. So concept is nothing but it is a generalized property or characteristics associated with either an object or an event or a people. So it is the key word is that it talks about the property or it talks about the characteristic of either an individual or it can be characteristic of an event or an object. For example, characteristic of an individual. We sometimes say that she is very kind, she is very humble. When you use these words, you are actually referring to the characteristic of an individual. So when I say, or when one of my friend is telling that she is very kind, I have automatically a picture in my mind what is kindness. Same way when somebody is saying that she is very caring, we all have a picture of what is caring in our mind. So using that particular general image what you have in your mind is called as a concept. So, in other words, we can say that concepts are the building blocks of all thinking because we cannot imagine a life without a concept. Because when we talk with someone, when we share certain facts with certain people, what we talk is based on a concept. When someone says that I ate an apple, I know what is an apple because I've already seen it and that image is there in my mind. So concept is nothing new. It is something like it is the building block of all thinking, which is referring to the characteristic or properties of either an object or it can be an event or people. So now let us look on to the definitions of concept. First, what is a definition based on Webster's dictionary? Concept refers to something that is conceived of in the mind. That is what I was trying to explain to you. Like anything which you conceive in your mind is called as concept. If a person is telling today it is very hot, okay, even without even feeling what is that hot, I can immediately understand what that meaning is for the word hot or cold refers to. So it is something that is conceived of in the mind. According to the famous and the most well-known nursing research textbook, Pollitt and Beck, the word concept is abstraction of a particular aspect of either a behavior or a characteristic. Abstraction refers to like the mental image what we have in our mind. So that word is called as a concept. So it refers to all things that are either tangible or it can be intangible. What do you mean by tangible and just the opposite? Tangible means what we can observe. When I say that this is my smartphone, okay, when you see the smartphone, you say that it is an observable object. But when I say that he was very rude to her, okay, you know what do you mean by rudeness? Okay, like we all have a mental image of that. So certain concepts are observable like your smartphone or maybe you observe an object, maybe a shirt or maybe a skirt. Okay, so those things which are observable are also concepts. Same way there are certain concepts where you cannot observe it, like rudeness or kindness, caring, loving, genuineness, humble, humility. All these words are certain words where you cannot directly observe. I cannot show you what is genuineness. I cannot show you what is humility just like I show an apple or an orange. So, certain concepts are very directly observable, while some concepts are not directly observable, which means they are not as concrete and directly seen. Example is memory. I'm sorry that the word has come together. It's actually the example is memory. When I say memory, okay, when I say in my memory, you understand what I'm trying to tell. Okay, that word memory, I cannot show you this is what is memory. So there are certain words which are observable, there are certain words which are not observable, like the characteristics of a person. So examples of concepts where you can directly observe is, suppose if I measure the height, the weight, the color of the eyes, the color of the skin, the color of the hair, okay, all those things are directly observable items. So such things are called as tangible concepts, or which means which are directly observable. But there are certain concepts which are not directly observable, which we use in research. Example, when I want to measure the knowledge, when I want to measure the attitude, when I want to measure the self-esteem of a person. Okay, I cannot directly observe it like I measure the height and weight. I cannot measure the knowledge and the attitude and the self-esteem. In that cases, what we do is we prepare certain questions, and with the help of a questionnaire or an interview, you're going to assess the knowledge or the attitude or the self-esteem. So those concepts which are hidden, those concepts which are not directly observable are also used in nursing research. So this is what we should understand by the word concept. So, what is a concept? Concept is something, a certain word or an image which is formed in our mind, okay, which is conceived in our mind is called as concept. And what else should I know? There are certain concepts which are directly observable, while there are certain concepts which are not directly observable. We can use both these concepts in our research or in our theory, nursing theory. Okay, so directly observable example best is height and weight, whereas not able to observe directly is usually the characteristics what we want to study, like satisfaction, patient satisfaction, or maybe the attitude or the belief or the practice. So next, with this clear understanding of concept, let us move on to study what is a construct. So a construct is a higher order concept is called as construct, which means it is a higher level of abstraction than concepts, which means again they may not be directly observed. So construct is similar to concept. The same concept, okay, it is similar to concept. The only difference is it is a higher level concept. What do I mean by a higher level concept? A higher level concept means that the level of abstraction is very high. Okay, which means most of the time construct is not directly observable. Like for example, memory, knowledge, maybe the practice, or maybe the uh, depression level, anxiety level of patients. All these words are actually a higher level of abstractness, because directly I cannot measure what is the anxiety just like I measure the weight of a person. So a higher level concept is called as a construct. So the key word to underline in the word definition of construct is it is a higher level of abstraction than a concept. Example, justice, happiness, patient satisfaction, health. When I tell this, immediately I cannot measure and say this is justice, this is happiness. Only thing is I may have to develop a questionnaire or a rating scale and then try to measure what it is. So that is about the word construct. Now let us see the definition according to Pollitt and Beck. A construct is an abstraction inferred from situations or behavior. So the key word which I would like to highlight in this definition is it is an abstraction, abstract level of concept. Okay, and according to Kerlinger and Lee in the year 2000, they have defined constructs are abstractions which may be deliberately invented or constructed by researchers. I would like to comment on this because it is a deliberately invented word which I put in the nursing theory or which I put in nursing research. Invented word. Okay, so I will give you an example in the later slides for a theory. Now, with this understanding, let us see again the construct is either specifically chosen, like for example, memory, or it can be created. How do I create it? Say, for example, in Orum's theory of self care, Oram has said that there is a construct called as self care. Actually, we know what is self, we know what is care, but a new word has been invented that is called as self care. Same way, if you're going to see King's theory of goal attainment, is again an invented word. It is an invented or a created word from, say, two or three concepts you take together and then you combine and you form a new word, and that becomes a construct. Now, let us see an example. A simple concept is, say, height or weight or mid-arm circumference. But a new word or a word which can be used as a construct is anthropometric measurement. Now, anthropometric measurement is a word which is having, say, three dimensions, that is height, the weight, and the mid-arm circumference. Okay, so now if you're going to see this anthropometric measurement, that word is a construct, whereas height, weight, circumference, etc. is going to be a concept. So what I understand is certain concepts are unidimensional, while certain concepts are multidimensional. Multidimensional means, say, for example, when I say the word emotional state, when I say emotional state, that is a construct, because under that emotional state, maybe I will have certain other words like happy, sad, anger, jealous. So these are the various words which can come under the word emotion. So emotional state is a construct which is having a lot of dimensions like happiness, sadness, etc. So which means a concept is usually, okay, lower order concept is usually unidimensional, while a construct is most probably a multidimensional. So how do I get it? Either I choose a specific word for construct like anthropometric measurement. It is not a new word. It is not a created word. It is already there. So I specifically choose that word. Or what I do, the researcher is going to create a word. Say, for example, patient satisfaction, self-care, self care deficit, goal attainment. So we have so many words where you can combine the concepts and create a construct. So, example of construct, as I told you earlier, in Orum's theory, self-care is a word which is actually a invented word. Same way in Jean Watson's theory of caring, she has told a lot of concepts and construct, but in that her main one construct is character factors. Now, what is character factors? Under character factors, Watson has told a lot of things. Say, for example, 11 character factors which are essential for a nurse when she is taking care of a patient. Now, that word character factor is an invented word or it is a created word, and it is multidimensional. It is a higher level of abstraction. So, we can say that word is a construct in a nursing theory. So, this is what is mainly we should the knowledge what we should have related to concept and construct. Now, as we are concluding, let us look into the main differences between concept and construct. Concept is a property or characteristic associated with object, event, or a people. Concept can either be tangible concepts where you can directly observe it, or it can be by indirect observation. Usually, lower order concepts are unidimensional. Coming on to construct. Construct is a higher order level of concept is called as a construct. It is either chosen or it is created or invented by the researcher or by the theorist. Usually it is not directly observed, and again, most probably it is multidimensional. See, there is no specific law to say that it must be multidimensional. No, it is multidimensional. Mostly it is a created or an invented one. So this is what we should understand, the major difference between a concept and a construct. Concept is characteristic. Construct is the same concept with a higher order level. Okay, concept you can directly or indirectly observe it. Usually a construct is measured indirectly because directly you cannot observe it. Usually a lower order concept is unidimensional and most probably a construct is multi-dimensional. So this is what we should know. What is concept? What is construct? What are the main differences? Because we may use concepts in our research, we may use construct in our theoretical framework in nursing research. So we will definitely study both concept and construct in nursing theories, because concepts and constructs are actually the building blocks of nursing theories. The same thing is applicable in nursing research. So next time when you look at the word concept or construct, please be very clear what is a concept and what is a construct. Higher order level of concept with a higher abstraction, usually not directly observable, and having multidimensional is called as a construct. So thank you very much for your great support.